my name is Jenny. I will be demonstrating a video on how to administer medications IV push through a central line, or more specifically through a PICC line. So I'm going to go ahead and look at my MAR. I'm seeing that my patient is Bob Owens, date of birth 9/22/1933. I'm looking over his allergies. I see he's allergic to morphine, and it looks like he has a new order in for hydromorphone 1 milligram IV push every 3 hours as needed for pain, and he has not received this medication yet. And I was just in my patient's room and I did a pain assessment, and he rated his pain at an 8 out of 10, and that is because he was admitted with pneumonia due to secondary to his lung cancer. So he's complaining of chest pain when he coughs. So I will prepare this medication for him outside of the room. And I'm going to go ahead and gather my supplies, and I'm going to look through my drug book and my Betty book, which I have already done. So I will be administering hydromorphone, and I know that my vial comes in 2 milligrams per 1 milliliter vial, and my order is for 1 milligram. I did my math, and that comes out to 0.5 milliliters per dose, which is equivalent to the 1 milligram. And then I looked in my drug book. I see that the administration rate for hydromorphone is for 2 milligrams, administer over 3 to 5 minutes, and also to dilute the medication with at least 5 milliliters of normal saline or sterile water. Okay, so I checked that. I checked my compatibility in my Betty book of my saline flushes or normal saline with my hydromorphone, and they are compatible, so I will be able to use those together. I'm going to wash my hands. Before doing that, I'm just going to grab some gloves. Okay, and before drawing from my vial, I will check my expiration date. And the expiration of the hydromorphone is 12 of 2030. Saline flushes, 11 of 2020. And September of 2021. And September of 2021. So my saline flushes are good to use. So first I'm just gonna cleanse the top of my vial. And just kind of while I'm doing this, I'm gonna talk over reasons why that you would have a central line. And some reasons for having a central line is maybe that your patient is on dialysis. Maybe your patient has poor peripheral venous access, or maybe they're on long-term IV antibiotic therapy. Okay, so just drawing back 0.5 milliliters of air that I will instill into my vial. And I will carefully draw back. Okay, do you want to visualize my Okay, so I have my 0.5 milliliters drawn up. So at this point I'm going to do my 3 checks for my 5 rates. Okay, and I'm looking over my MAR, and I know that my patient is Bob Owens, and that he has an order for hydromorphone, and that I know that the dose to give is 1 milligram, which calculated out is 0.5 milliliters, IV push at this time, and it is 2:30. So I am administering to Bob Owens hydromorphone, and I am giving 1 milligram, which calculates up to 0.5 milliliters, 0.5 milliliters, IV push right now, and it is 2:30. I have Bob Owens. I will be administering hydromorphone. Hydromorphone, 1 milligram, calculates up to 0.5 milliliters, 0.5 milliliters, IV push right now, and it is 2:30. And I also double checked allergies, and I know that he's just allergic to morphine, which is okay to use the hydromorphone. Okay, I will also prepare my saline flushes outside the room, making sure there's no air in them. I will need to dilute my medication into one of my syringes. So I'm actually going to waste a little bit, because as long as I'm diluting it in more than 5 milliliters of normal saline. Okay, and I will get rid of that excess air. And then it's also very important I prepared a label to label my syringe, noting that this is hydromorphone. Okay, I have all my supplies ready. I did my checks. I am ready to head into my patient's room. Okay, actually let's use some more gloves. For privacy. Wash my hands. Hello, my name is Jenny, and I will be your student nurse today. Can I please have you tell me your full name and date of birth? And he tells me Bob Owens, date of birth 9/22/1933. Okay, thank you very much, Bob. I am coming by because I came by earlier and you had rated your pain an 8 out of 10 and said you were in quite a bit of pain. So I looked at your orders, and it looks like we can give you some hydromorphone. And I just want to double check on allergies. Are you allergic to anything that I should know about? And he tells me the morphine, which matches the MAR. So that's okay to use a hydromorphone. And Bob, I am here I do want to let you know this medication, some of the side effects is that it may make you feel a little drowsy or maybe a little nauseous to your stomach. So I'll be watching you closely after I administer it, and I do want you to call for help if you do need to get out of bed, because you may be a little unsteady on your feet. So I'm going to go ahead and get my supplies ready before I administer. Okay, and I'll be administering through PICC line. To start, I just want to assess my site. I'm assessing for any signs of infiltration or phlebitis, any swelling, making sure everything's intact, and it looks great so far. Just gonna clamp before, so clamp that. Okay, so to administer, I'm gonna first start out by cleansing my port and use per facility policy the line that they want you to use, and this is the white line. So I will use this one, and then cleansing solution per facility policy, as well as the amount of time to cleanse for, which is about typically 15 to 30 seconds. So I'm going to cleanse that. Okay, and I'm going to grab my first saline flush. I'm going to attach my syringe. I'm going to unclamp it. Now I will administer the first saline flush, nice and gentle. good. Clamp my line, disconnect, toss that. I'm going to cleanse my port again. And now I'm going to connect my syringe with my medication. Okay, and I know that I need to administer this over 3 to 5 minutes. I unclamped it. I'm ready to instill the medication. Look at my second hand watch as I'm slowly pushing the medication little at a time. I'm also assessing my patient as I'm instilling the medication, assessing for any adverse reactions. Okay, and 3 to 5 minutes has passed. I'm going to clamp my line, disconnect, dispose of that. I'm going to cleanse my port one more time. And I will attach my last saline flush. I will unclamp. And since this patient has a PICC line, I'll be flushing with the pulsating technique. And I will do it slowly for the first 30 seconds. Try not to bolus the patient with the medication in the line. Also assessing still for any adverse reactions. Okay, clamp my line. And then depending on your facility, you may need to cap your line with a impregnated CHG cap, but we do not do that at this facility, so I'll just cleanse it once more. How you doing, Bob? He says he's feeling fine. I'm starting to feel the effects of the medication. So I'm gonna dispose of my gloves and my supplies. I'm going to wash my hands. I'm going to ensure safety. I will lower the bed, make sure call light's within reach. Some lifespan considerations is the elderly are susceptible to adverse reactions, especially with pain medications. So I will ensure that the bed alarm is on, call light's within reach. I may be checking on my patient more frequently. I will also be coming in for a follow-up pain assessment, making sure that the medication was effective. I'm going to document the date, the time, the medication amount that was given through IV push through his PICC line, how he tolerated it, the pain assessment before, the pain assessment afterwards, vital signs before as well as afterwards. And that concludes my video. Thank you.